Good morning, Professor Prat. Can you introduce yourself and the topic of your study?
Yes, so I'm Frédéric Prat. I'm the head of the endoscopy unit in the academic hospitals of Paris at Paris Descartes University. This work has been essentially achieved by Dr. Benoit Bonassart, who is one of my co-workers and assistant professor in my team. So, if you want, I will read the title of the article for you. It's entitled Clinical Efficacy of Anti-Migration Features in Fully Covered Self-Expandable Metal Stents for Anastomotic biliary strictures after liver transplantation. And it's a comparison of standard and anti-migration stents.
What drove you to undertake this study?
We have a long-standing history of cooperation with liver transplant teams in academic hospitals of Paris, especially with the Pitié-Salpêtrière Hospital. So for approximately 15 years, we've been treating patients with anastomotic biliary strictures, post-OLT. Of course, we've treated many patients with plastic stents, with the standard multiple plastic stent procedure. When metallic stents appeared approximately 10 years ago, a little more than 10 years ago, we were keen on treating patients with these new devices, hoping for better results and easier procedure for the patients. So we first worked on partially covered stents, and we had a first study published in 2010, published in GIE, with Dr. Sheffield as the first author. But these stents were difficult to remove and could not be left in place for a long time. So when fully covered stents appeared, we were enthusiastic with the stents and conducted another study, which was published in 2015 in UEG Journal, and we found that we had satisfactory results, but not so good, essentially because of the high migration rate. We had a 25% migration rate in this study, and liver transplant, post-OLT strictures, was a significant risk factor for migration. So when new stents appeared equipped with anti-migration features, we tried also these stents. Some time passing, we had the feeling that these stents were probably better, that we had less migrations than with previous models.
So can you explain the design of the study?
So it's a retrospective study on only one center, based on two different databases, one from our endoscopy center and the one from the liver transplant center. So all the patients have been followed up very thoroughly, and subsequently there's absolutely no patient loss with follow-up, which is one of the shortcomings of many retrospective studies. And the different types of stents have all been used at the same time, which makes this retrospective study a relatively robust one. And the primary objective of the study was the migration rate. Secondary outcomes, outcome criteria were stricture resolution.
Can you describe the specific stent that you wanted to evaluate in this study?
Yes, pleasure. So the stent is a fully covered self-expandable stent, slightly enlarged at the distal part. It's equipped with wires for an easier removal, one at the distal part and one at the proximal part. But the essential feature of this stent is the presence of four small flaps, which are weaved within the proximal part of the stent, approximately 5 millimeters from the very tip of the stent. I can put it here if you want to have a closer look at it. As you can see, these flaps are flexible, but they are also very smooth. They are not traumatic to the mind at all. And when the stent is pulled off, it comes generally very easily.
Can you please briefly explain the results of the study?
Yes, of course. So we have included 75 patients in the study, receiving a total of 125 stents. So importantly, there was no difference in terms of patient characteristics and previous history of the patients with regard to their anastomotic stricture between the different groups. The groups were comparable. And regarding the primary endpoint, the difference was very significant with an overall migration rate of 16%, but with 28% in the standard group, which is similar to our previous findings in the previous study, and only 1.7% in the anti-migration group. So this was very, very satisfactory. And in terms of stricture resolution rate, we had also a significant difference in favor of the anti-migration stents, which results from the reduced rate of migration. And we had also a lower recurrence rate after 1 year of follow-up in the anti-migration group.
So thank you very much. What are now your conclusions and what would you see as next steps after this work?
So I think we can conclude that this work has demonstrated the advantage, the superiority of these new stents in terms of migration rate, and subsequently there's also an advantage in terms of stricture resolution and stricture recurrence, which is very common in post-quality biliary strictures. So I think now, of course, it remains a retrospective study, and I think it deserves more robust results to confirm that. And the next step in my view would be to compare the standard procedure, which remains the multiple plastic stenting, with these new anti-migration stents. And I think that we should be able to demonstrate at least equivalence or even superiority of the stents with a much less cumbersome procedure for the patients.